We're up pretty good. There you go, that's fine. Let's see. A little sore right there. And there, on the other side, same spot. Ain't nobody. It's okay. It's okay. It's alright. I'm not gonna hurt you, I promise. It's okay. It's okay. Got hooks on the side of this corner incisor. Did you see how he was just doing that? That was because, let's see, he's nervous. That was painful a minute ago. That lip quiver. Big guy in college. Get that one hooked in too. Big guy. Not a big deal. It's alright. Okay. Alright. They're half in the ground so they stay cool.
Yeah, but they'll sweat like crazy this kind of weather.
So, on it goes. So this is going to end up looking a little bit more over-professional than it has to. Not sedated enough. Because if you compare it to a drunk driver, the drunk driver continues to drive stupid until he's so drunk he can't get in the car. Right? So you have to beat the desire to drive. You have to beat the desire to fight, right? Or to resist. Fight is a strong word. They're not trying to literally fight with you usually. They just think, well, it's abnormal to have this in my mouth or have you reach into the back of my mouth. So they resist. It's a natural defense mechanism. So usually when we get a horse that's doing those types of things, we actually reach for more sedative, and an owner that hasn't been a client of ours for a while might go, oh my God, Doc, he's already over-sedated. Why are you getting more? When in reality, they haven't had enough. You haven't reached the point where they don't care to fight you anymore. So, and that comes at a different place with every animal. That's why we keep records. Every time we write the dose we used, when we gave it, what the response was, so we can tweak over time. We can tweak it over time so that after I do a horse a couple times, I can nail his sedation protocol right down to the wire. Got that in hand. Let's do his roster fog mobility in his door. He's leaning that way a little bit, so just watch so that he doesn't stumble. Keep his eyes really nice and level. That's good. Turn him back as well. Go up a little. He's going to reposition. A little bit nervous about this. Now he has these hooks right here on his corner incisors that may prevent his jaw from moving back like it should on the bottom. So when we take those off today, you may see an improvement in the amount his jaw is able to move front to back. In your big game. It's okay, I know. This is lateral excursion to molar contact. Oh buddy. To the left. Oh buddy. And to the right, and he's symmetrical right now. In those hooks. He hasn't got any outward evidence. He's clipped himself there. That's an old scar. Could have been from a sharp piece of hay. Okay, real nice and straight.
Is that pretty good looking?
Pretty good looking mouth. Okay. He does have lacerations in his cheeks. I'll show you those. black lines. Those are rubs from the points back here.
Okay.
And he's actually got a little red spot there that was bleeding a little bit.
Yeah.
Right there. You can see when I push the cheek just right.
Yeah.
And then he has similar things over here. That's from the points rubbing on his cheek. And those aren't terrible ones. So you're catching it at a point where we can help him out before it gets bad. Either side of his tongue looks pretty good. And right there, look at this one, Wayne. See the food stuck in there?
Mm-hmm.
See how the probe just kind of fell down into that hole? Okay, so hopefully floating him will alleviate the food from getting stuck in that hole right there. Alright. Got a little bit of a diastema there. Got the separation between his teeth right here. 6, 7, between 7 and 8, right there. That line between his two teeth really shouldn't be there. Should be a potential space, but the two teeth should be slammed right up against each other. And they're not over there. Whereas the tooth on the other side, the mirror image, so to speak, on the other arcade, it looks fine. You're young and inexperienced. I'll work with you, buddy. Good boy. So if you look in here now over my right shoulder, get that? How's that?
Same shoulder. Now the points are gone in there.
Yep.
Okay.
All right. And these aren't terrible points either. Like that horse yesterday. I'm going to keep going and he's going to figure out that wasn't so bad. Good boy.
That's good.
Yeah, you can really see.
I mean, it's impressive when you can see it halfway across the room. Now, if these are too big, you can't take them all off in one setting because you'll get into the live part of the tooth and you don't want to hurt him. That's not the idea. And you can see how, you look carefully at this tooth over here, it's actually rounding and grooving the back of this tooth right here. You see that?
Mm-hmm.
It's cutting a groove in the back of it. Not so much over here, it's hitting kind of the back side of that one. By putting the back of the instrument on their teeth and then rolling it in and taking it off quickly. See how he shatters a little? And then I use the rest of the tooth as my guiding line for how I want that to be initially. And then if I need to change something, I can. But that's already gone. And if you feel with your finger, you can actually tell better than with your eye that you have it the way you want it. Make sure it's not getting hot. You get to go. Come on. There you go. Look how good you got. You almost got to get right down at his at tooth level. If you look down at it, you won't see the smile. So if you come up at it a little bit, you'll see the smile better. And it's subtle on him, it's not real obvious. And then he has... And by the way, it doesn't hurt anything. It's not hurting my hand. It'll hurt it if I just bear down and hold it there, but obviously you don't do that anymore. Take off 2 to 3 millimeters on a tooth without getting into having a high risk of getting into pulp. So that's about where we call it quits when we're trying to correct any waves. A little lower. There you go. You probably got it. Now look at your lens.
Okay.
There, now you're getting the edge of the teeth up and point down a little bit. There you go. Okay? Alright.
Okay.
See?
So
that's abrasion on the front upper first incisors and the lower first incisors.